Hello, everyone, and welcome to this week's episode. Today, I want to talk about the misconception of postpartum healing journey. There's so many misconceptions out there, and moms emotionally, physically, like they don't feel like they're themselves postpartum because it's a rebirth for them as well. And that's what I want to talk about today. Let's talk about moms. What are they facing postpartum? What's normal? What's not normal? When to actually seek help? And I think this is a very important topic because we can't normalize being on ourselves just because we just had a baby. We can normalize just feeling different in our bodies, even sexually, even mentally, just because we had a baby. We're not going to bounce back in 6 weeks, but we will bounce back when we go into that healing journey of reconnecting, connecting with our private parts, with our body, with our mind. So let's talk more about that today. So, welcome to this episode. It's conception. Many new moms expect that a 6 weeks is just normal to get back to normal, especially after hearing that they're cleared for activities like exercises, sexual intercourse. However, this can lead to misconceptions and unrealistic expectations. While 6 weeks postpartum is often when medical professionals do a general checkup, this milestone doesn't mean your body has fully healed or regained its pre pregnancy state. Rather, 6 weeks is a checkpoint, it's not the finish line. So, recovery timelines, they vary widely from one person to another. For some, it might be 6 months. For others, it could be a year, 18 months. And pregnancy brings significant physiological changes. Childbirth, whether it was vaginal or C-section, is a profound event that places great demands on the body. Why 6 weeks is just the beginning. Pregnancy and childbirth they create unique changes in the body that last beyond delivery. Let's go over some of these changes. One, your body structure changes. The uterus expands, the blood volume increases, your hormone shifts, and postural adaptation develop throughout pregnancy. So that took 9 months to get to where you're at, to create that baby, that miracle. Now, we have a pelvic floor and abdominal changes. In vaginal birth, pelvic floor muscles, they stretch up to 2 to 3 times their resting length. And perineal tears are very common. You might have a 1 degree tear, 2, 3, 4 degree tear. You might have fecal incontinence postpartum if it is a big tear. For those who had cesarean birth, incisions through multiple layers of tissue require significant healing time. I don't want you to forget that this is birth as well, and this is a major surgery. So you need to allow your body to heal. Now, when it comes to hormonal adjustments, especially if you're breastfeeding, your hormonal levels don't immediately return to pre-pregnancy state. So this will affect your body's support system for the pelvic floor, for your vaginal tissues, and lower estrogen level during breastfeeding can also contribute to symptoms like pelvic heaviness, leakage, and discomfort during sex. And if you had an episiotomy, you're definitely going to have discomfort during sex, and we need to work on that scar. Here's my point. So if we go into a surgery for an ACL, knee injury, whatever, after that surgery, you would need to go to a physical therapist specialized in knee rehab in order to be able to walk again, in order to be able to go back to running, to go to your exercises, right? And that takes time. We created a baby for 9 months. We made that miracle and our bodies changed. And postpartum, whether you had a C-section or vaginal birth, you need to get through that re-education. Your mind, body, and pelvic floor need to heal. You need to connect to your body. You need to process. You need to understand what's going on. And you need to let go of anything that is still lingering down there, as in pain, tension. We need to figure out what these are and work on them. No two postpartum journeys are identical. Some people feel relatively well shortly after birth, while others take longer to feel balanced or regain energy and strength. So movement and exercises should align with the body's need and recovery process rather than with just external expectations. It's going to take some time to get back to running postpartum without leaking. It's going to take some time for your body to heal, and you need to be proactive about it. As a physical therapist specialized in pelvic floor health, I often recommend setting manageable, gradual milestones instead of expecting a rapid return to your pre-pregnancy body. And we'll discuss ways to ease into exercise safely, which is especially important if you're experiencing any postpartum symptoms like leaking, pelvic pressure, or pain. So, the first 2 weeks focused on rest, breathing exercises. We need to work that diaphragm. Your diaphragm has been stuck up there to accommodate the baby. So, we need to allow that diaphragm to get its full range of motion back. It needs to descend as we inhale, allow the ribcage to expand, allow the pelvic floor to drop. They work together. And if your diaphragm is still stuck up there, you take a deep breath and you're breathing through your chest. The diaphragm is not functioning properly, and this is the first step towards healing. The first 2 week focus on the diaphragmatic breathing. Exercise as in gentle core engagement. Get that core muscles back in place slowly. And then reconnect with your breath, your body. It can be grounding and restorative. And then weeks 3 to 6, gradually increase your walking endurance if you feel up to it. Consider gentle mat-based exercises that activate the pelvic floor and core muscles without strain. After 6 weeks, with approval, begin low-resistance exercises like using bands or light weights, strengthening their glutes, hip muscles, postural muscles. It is a really important component for postpartum symptoms and fitness. But I want you to check in with yourself. Am I leaking with exercise? Am I seeing any doming or coning in your abdominal area as you're doing this exercise? Do I have any pain when I'm doing this exercise? These are really good questions for you to ask, because this is how you tune into your body's trying to tell you something. Hey, I'm not ready. This is very advanced for me. I'm not there yet. And that's okay. Which is why I want you to go back to like step by step, getting into the healthy flow of life, healthy flow of exercise without feeling pressured to run right away. No, your body needs time to get there. It's like building blocks. Step by step, you'll get there. I'm just going to debunk a few myths that we usually hear. One, you should be back to normal by 6 weeks. This idea can place unnecessary pressure on the mom, and full recovery can take many months, and that's completely normal. Like last week, I was talking to the group of moms that took my Prepare for Birth class, and we were talking about that postpartum challenge that I'm setting up. And it's been 1 year since they gave birth. One of them had a VBAC, vaginal birth after C-section. The other one had a vaginal birth. And there was some that had C-section. So all of them, like right now, 1 year later, they almost feel like themselves. They feel like, okay, I have the time to connect with my body. I'm sleeping a little bit better. So many things play a major role in healing. So give yourself some grace. Ask for help when needed and slowly go back to normal. Don't feel pressured. And postpartum recovery is not a straight path. It's filled with highs, it fills with lows. Some days you may feel great, others you may feel drained, sore. Again, depends on how much you're sleeping, if you're breastfeeding or not, if you had any episiotomy, any scar from the C-section. These play a major role in your healing journey and how you feel. So it's important for you to take care of these scars. It's important for you to slowly get back to the healthy flow of life so you're able to provide or show up for your babies. And I know we don't feel like we have time at all to just connect or to do something for us. But if it's only 10 minutes a day, which is usually what I do with my challenges, delegate, ask for help. You're not supposed to do it all. I know it takes a village to raise a child, and sometimes we don't have the luxury to have family or help. If you can, just get that 10 minutes of, I need my time. I need to connect to my mind, to my body, to my pelvic floor. I need to see where I'm at. How am I feeling? What do I need? That's important. Do it. Guidance and support, they really matter postpartum. And it's beneficial to seek out guidance, whether from your medical provider, pelvic floor therapist, or a supportive postpartum group. With proper guidance, you can work through your challenges, celebrate your progresses, and reach realistic milestones in your recovery. So I want you to prioritize your postpartum journey, your unique journey. I want you to take some time to love yourself again. That self-love practice, that connecting with, okay, what do I actually need right now? What is my body telling me now? What do I feel like doing? Is important. Whether it's walk in nature, whether it's just doing some diaphragmatic breathing, whether it's just seeking help, do it. And I just want to touch base on Kegel exercises and biofeedback machine. Biofeedback machine, it's a machine where you insert the probe in your vagina and you can see how much you're squeezing and relaxing. And the Kegel exercises started whenever Dr. Kegel in the 1940s, he just assumed that, okay, the pelvic floor muscles are weak, so we need to squeeze them to make them stronger. And that's what postpartum moms have. They have the weak pelvic floor muscles, which is why they're leaking on themselves. So according to that assumption, they started giving out those Kegel exercises like a blanket exercise for everyone that just gave birth. C-section, vaginal birth, you're leaking on yourself. Whether you had vaginal birth or C-section or you never had any kids, you're leaking on yourself. They thought this is just because the pelvic floor muscles weak. We need to squeeze them. And I have some patients that come to me and they're like, yeah, I'm doing my Kegels. I'm squeezing while I'm peeing. Oh, please don't. That could create a risk of UTI, and urinary tract infection. You can't just squeeze that pee back up. So 1, you need to empty your bladder if you ever want to do this exercise. 2, you don't do it while you're peeing. 3, so many of my patients don't even know how to squeeze that muscle. Kegel exercises, a biofeedback machine, squeeze and relax the muscle all day long are not, I repeat, are not a treatment plan. We have to focus on a holistic body approach. Your hip muscles change. You were in total external rotations walking like a penguin when you're 9 months pregnant. Your diaphragm is not the same. Your pelvic floor muscles are not the same. Your abdominal muscles are like sleeping because they overstretch to accommodate the baby. And this is a beautiful, amazing, genius thing. It's a blessing. Imagine your abdominal muscles can't overstretch to accommodate the baby. Where would that baby go? In your back? So your body beautifully created that miracle and changed according to what your baby needed as you were growing that beautiful soul and connecting to that soul. And then going through birth, whether it was vaginal birth or C-section, your body already changed. Your body already got affected. And the C-section scar, oh, we need to work on that so that we prevent adhesions, we prevent urinary urgency later on, we prevent any low back pain, we prevent any issues. You had an episiotomy or you had the laceration in your pelvic floor muscles, definitely we have to work on that. Because painful sex, you might have it. Prolapse, you feel heaviness in your vagina at the end of the day, this is a sign that you need pelvic floor support. And no amount of Kegel exercises or biofeedback machine will actually fix that. Sometimes it actually increases your symptoms as in pain because a strong muscle or a tight muscle is not strong, right? So we need to focus on the hips, on the breath, on the abdominal muscles, check if you have any abdominal separation, diastasis recti, and check if you have any pain in your pelvic area or not. So look at the whole body, like even look at your feet, at the dorsiflexion, at your ankle. We have to look at the whole body because the body works as one system, not just the pelvic floor muscles work alone. Definitely not. So please, we need to stop giving Kegel exercises for everyone. We need to stop just putting a patient for 20 sessions on a biofeedback machine all day long, and then their symptoms are not getting actually better. I see so many patients that are coming back to me after having to go to a pelvic floor therapist and just was put on that machine and tell them, okay, bye, good luck. Oh, that's not what you deserve. This is not a treatment plan. A solid treatment plan is 1, learning how to assess yourself, learning what is wrong with me. So let me go through that assessment. I include in my program. And whenever I do even a one-on-one consultation with my patients in the Middle East, because I know we don't have a lot of pelvic floor therapists there, so many of my patients are in the Middle East as well, I walk them through an assessment. I want them to be in a quiet room, total privacy, lock the door, nobody's coming in, and I want you to sit with yourself in a sacred space all by yourself, and I want you to assess. I'll walk them through an assessment. Assess your abdominal muscles. Do you have any abdominal separation? How deep it is? Where is it? Okay, now assess your pelvic floor. Is there any pain before you have sexual intercourse? Check yourself. If you have pain, you have pain. We have to fix that. Let's assess your breath. Let's assess your hip muscles. Let's assess your ankles. Let's assess your posture. Now let's slowly give you the exercise and tell you why am I giving you this exercise. And this is it. Once we figure out the root cause, what is actually causing your pain? What happened during birth? How did you give birth? Was it emergency C-section? Was it elective? Was it vaginal birth? Did you have an episiotomy? All of these play a major role in your postpartum rehabilitation. Even if you had a C-section, we have to work on your pelvic floor muscles and your full body to actually recover. And if you're planning to have a vaginal birth after a C-section, we have to work on that too, to get your body back in place, to help you reconnect to your body, because you will feel disconnected. You will feel disconnected from your private area. You're not going to feel like yourself. And honestly, this is almost like a normal pattern that moms go through. You are going through a rebirth, a total new person with a new soul that you need to take care of. So it could be a lot. You might not prioritize yourself, but trust me, it's important to put some time for us and take it from there. And another note I want to talk about is to prepare for birth. So if you want to give birth next time, or you are planning to give birth, please go in fully informed about the process. The pushing stage specifically, how you push, the amount of time you're pushing, if you're pushing effectively or not, can indicate and can help you decrease the risk of postpartum pelvic floor dysfunction. Because if you're pushing too much in the wrong position, you might have an increased risk of an episiotomy, a coccyx injury, coccyx pain later on, maybe prolapse. So it's important to understand where you're at, what you're doing, connect with your body, going in fully informed about the process, asking for what you need, protecting your pelvic floor, learning about the biomechanics of the pelvis and how it opens, because you're able 100%, unless you have placenta previa, unless you need actual medical guidance for sure, to birth a baby all by yourself. If you know how to connect with that baby, if you know how to prepare the hips, the pelvis, and your body for birth, which is what I educate moms as well, because I want them to go in fully informed, with an open mind as well. We can never control birth. You might have to go through a C-section because it saves lives. It could save your life and that baby's life. But you can as well go through a smooth vaginal birth if you learn and know how to open each section of the pelvis at different stages. And if you prepare your body, your mind, and your pelvis for that. So this is just on a side note. Don't go in not understanding anything and just waiting for the doctor to birth you. You honestly don't always need a doctor to birth you. You know how to birth yourself. You know how to connect. If you only allow that space and that flow and trust your body and yourself. And doctors and the medical team are amazing. Like, they're there for support. They're there in case of emergency. But trusting yourself and your body and going through that as well is important. Just to wrap it up, there's no one size fits all for postpartum healing. There's no one size fits all for a recovery process. It's a healing journey. Give yourself some grace. You're doing a lot. You're doing great. And give yourself some time to connect, to heal, and to feel like yourself again. If you guys have any questions, need any help, any support, I'm always available. You can always text and comment here if you have questions. I hope that session was insightful. I recorded it in English because I do want everyone to understand what I'm saying. Take some time for yourself.